Hello, friends, and welcome to the show. This episode, I'll be talking about how the United States has a sudden drop off in COVID 19 cases in the last 2 to 4 weeks. As you recall, I did a video a few weeks ago basically talking about how the World Health Organization quietly changed the standards of the guidelines of how to perform the PCR tests. So let's read this article from the New York Times. Coronavirus in the US, latest map and case count. The state of the virus. Cases have fallen more than 40% over the last 2 weeks and more than 70% since the January peak. Fewer people are testing positive each day than at any point since last October. Deaths remain extraordinarily high, with more than 2,600 announced on Thursday alone. In the coming days, the country is likely to reach around 500,000 total deaths, but reports of new deaths are starting to slow. About 62,000 coronavirus patients were hospitalized nationwide as of Thursday, according to the COVID Tracking Project. That's a decline of more than 50% in just over a month. As of Friday, 11 states with the highest rates of recent cases all come from border of the Atlantic Ocean. Though the case numbers have fallen somewhat in South Carolina, the Spartanburg, Gaffney, and Orangeburg areas still have some of the worst outbreaks in the country. Highly infectious variants continue to emerge across the country, potentially undermining some of the progress of the last month. Even as the federal government ramps up tracking efforts, the pervasiveness of those variants remains largely unclear. About 12% of people in the country have received at least one vaccine dose, and about 5% are fully vaccinated. After weather related delays, federal officials have said they hope for the pace of vaccination to rebound soon. This second to last bullet point is pretty important. I'm old enough to remember back in December when the UK variant was first discovered, where Fauci said, "Oh, I don't think we need to limit travel from the UK to the United States. We just need to keep an eye on it." No, 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 no. We need to have an abundance of caution. We know the threat of COVID 19. And now you're saying there's COVID 19 2.0, the redux, right? Something even bigger, badder, stronger. COVID 19 on steroids that's way more transmissible. And you're saying, oh no, we just need to keep an eye on it. We don't need to limit travel from these other countries because, we don't know what's going to happen. Well, we know that it's more transmissible. At least it was believed to have been, and it is now confirmed to be more transmissible, right? And you didn't want to limit travel, and now we have all these variants in the United States, and it could have been prevented or slowed down at least if we were to practice an abundance of caution. But of course, we didn't want to be xenophobic to all those white Europeans in the UK. Come on, it doesn't even make any sense. It's not even something controversial. If anything, you're banning the people that right now Democrats hate. They hate white people. They hate white people of European descent. Excuse me. They hate white people of European descent. So it would stand to reason, well, let's keep all the white people out. It doesn't make any sense. It just doesn't make any sense at all. But the burningplatform.com reports, and this was something I covered a couple weeks ago, so I'm going to kind of burn through this pretty quickly. Numerous epidemiological experts have argued that cycle thresholds are an important metric by which patients, the public, and policymakers can make more informed decisions about how infections and or sick an individual with a positive COVID-19 test might be. However, as Just the News reports, health departments across the country are failing to collect the data. In fact, as far back as November, we brought the world's attention to the COVID-19 case demic and the disturbing reality of high cycle threshold PCR tests being worse than useless as indicators of COVID-19 sickness, PJ Media's Stacey Lennox said at the time. Biden will issue national standards like the plexiglass barriers in restaurants he spoke about during the debate, and pressure governors to implement mask mandates using the federal government's financial leverage. Some hack at the CDC or FDA will issue new guidance lowering the CT the labs use, and cases will magically start to fall. In reality, the change will only eliminate false positives, but most Americans won't know that. Good old Uncle Joe will be the hero, even though it is deep state actors in the health bureaucracies who won't solve a problem with testing they have been aware of for months. That they have been aware of for months. TDS is a heck of a drug. And now, as Lennox explains in details below, we have been proved 100% correct. As less than 1 hour after President Biden's inauguration, the WHO proved us right. And then they talk about how the New York Times published a story basically saying that current CDC, or at the time, the current CDC recommendations for a PCR test was you run that cycle threshold 40 times, when all epidemiological experts had stated, well, it should only be ran between 30 and 33 times. Anything more than that, you're just basically going to pick up dead viruses, and that'll just give you a false positive. Yet a PCR test instruction document from the CDC that had been revised 5 times since July 13th, 2020, specified testing and interpretation of testing using a CT of 40. On September 28th, 2020, a study published in the Journal of Clinical Infectious Diseases from Jafar had asserted that based on patient labs and clinical data involving nearly 4,000 patients, that a CT of 30 was appropriate for making public policy. Shortly before the New York Times article was published, the CDC revised its own COVID-19 testing recommendations, saying that only symptomatic patients should be tested. But then Dr. Fauci, there was a lot of media outcry. Dr. Fauci went on the media tour, and then the CDC went back and said everybody should be tested again. So, of course, what Dr. Fauci says goes. And Dr. Fauci is historically incorrect. They also go on to talk about how Dr. Fauci correctly said a year ago that there is no such thing, or there has been no real documentation of asymptomatic spread of respiratory diseases, but how he changed his tune later in the year, and that everybody should wear a mask and everybody should get tested and everybody should take, well, if it's not a thing, if you're not sick, then there's not going to be asymptomatic spread according to the science. But then today, within an hour of Joe Biden being inaugurated and signing an executive order mandating masks on all federal property, the WHO sent out a notice to lab professionals using the PCR test, translating to, in the absence of symptoms, a high CT value means you are highly unlikely to become ill or get anyone else sick in the absence of very recent exposure to an infected person. So basically, they were saying, basically, the new WHO guideline is you need to run that cycle at 30. So you're running that test 10 more times than needed. So you're getting a bunch of false positives. So you have a less sensitive test, you're going to have less positive results. That's the way it works. So a lot of the cases that would have been basically you're not going to get sick, or you're just getting over being sick and you just didn't know it, or it was just dead viral cells in your nose, all those tests would be eliminated. All those positives would be eliminated. So not always a false positive, but a false like active infection positive would be eliminated. But why did it happen? Why did the WHO change its tune on that day? It wasn't even a week later, a month later. No, it was a day. It was within an hour of Joe Biden becoming president. And why did this happen? Well, to make Trump look bad. And why would the WHO want to make Trump look bad? Secretary of State Antony Blinken on Wednesday said that the U.S. will deliver more than $200 million in assessed funds to the World Health Organization, following through on contributions largely delayed under the Trump administration. The secretary made his remarks during a virtual meeting of the UN Security Council, committing the Biden administration to working with the international community in beating back COVID-19 and distributing the vaccine. The article goes on to state the following. Today, I am pleased that by the end of the month, the U.S. intends to pay over $200 million in assessed and current obligations to the World Health Organization, Blinken said. This is a key step to filling our financial obligations as a WHO member. I'm going to say WHO from here on out because he says WHO a few times. I'm going to say WHO. It reflects our renewed commitment to ensuring the WHO has the support it needs to lead the global response to the pandemic, even as we work to reform it for the future. In April of last year, then President Donald Trump, this is editorialized, this is part of the article, right? This is no longer Blinken talking. In April of last year, then President Donald Trump froze all U.S. financial contributions to WHO and started the process to withdraw from the organization in July. But Biden rejoined WHO on his first day in office. Maybe I should have stuck with WHO. I apologize for that. However, this is extremely important to know. So basically, Trump said, no, I'm not going to pay you anymore. And why did he say that? Well, it's because the WHO was basically just being the mouthpiece for the CCP. The CCP had stated that COVID-19 could not be transmitted by air, right? It was not able to be transmitted through aerosol. And the WHO basically perpetuated that lie. And the US was basing policy off of a lie. So at a certain point, Donald Trump said, well, we're not going to believe anything you say anymore. And if we can't believe anything you say anymore, then we're not going to continue funding you. And we're no longer going to be a part of your organization. And basically, that $250 million that Biden's going to be paying them is a bulk of that money that they receive. The United States is one of the greatest contributors to the World Health Organization. And by us pulling out, where were they going to get that money from? So, what do? They ensure that Donald Trump looks as bad as possible. Their guidelines for the PCR tests were way wrong. And then, as soon, but not until Joe Biden is the president of the United States, they lower the standards to what it should have been. And then all these cases magically just poof, disappear. It seems too convenient to be true, but it is. As soon as Joe Biden said, "Hey, World Health Organization, I promise you and us, we're going to be together again. I promise. But please continue to make Donald Trump look bad. There should be an investigation into everybody who surrounds Joe Biden to see if anybody has a business interest in the dealings of the World Health Organization. Perhaps he has a brother or a son who is on the board of a company who receives money from the World Health Organization, because that's how Joe Biden rolls, friends. And if he's putting nearly $250 million, if he's pumping that into the World Health Organization, we need to see where that money from the World Health Organization goes to, because as an educated guess, wherever Joe Biden has influence over money, somebody in his family is collecting money as well. So we need to look into that, because it's extremely concerning. I'll say concerning and suspicious. It's definitely suspicious as well, because the timing is too convenient. Donald Trump said, no, we're no longer going to pay you because you can't be trusted. Joe Biden says, it's okay. We can trust you. We're joining back, and you're going to get all this money and then some. And then the WHO then changes its testing guidelines to make Trump look bad. That's the only reason. It's going to make Trump look bad. It's going to make Biden look like a man a god amongst men. Basically, it's going to make Biden looks so much better than Trump. And the real reason behind it is you change the guidelines of how you conduct the test, how you read the results. Of course, you're going to have less positives if the test is exponentially less sensitive. It's hard to wrap my brain around, and seeing this blatant corruption just in person out in the open and nobody's actually talking about it is quite concerning. So that's gonna be it for now, friends. I might post another video up this evening. If not, I'll post a few tomorrow. Until then, I'll see y'all later. Have a good one. Bye.